Hi, I'm Dr. Barker with Integrative Pain and Wellness Center, and if you've watched my video on how to release negative emotions, I talked about the two more basic components to releasing an emotion intentionally. And the two components are awareness and intention. And so with your awareness and intention, you can release any negative emotion that you're experiencing. However, there are some tools that can be used to aid in those two components. And so one of the tools that I use in my own practice and personal practice and within my practice with my patients is muscle testing. So this type of muscle testing is called applied kinesiology. And you can use muscle testing in a wide variety of ways. You're tapping into the inherent wisdom of the body and the energetic system within us. So you're using the meridian system and working with the meridian system to gain further information. And so you consciously have a small recollection of all of the things that have happened to you in your life. And so trying to consciously think of what emotions to release can be a little slow going and have some limitations. However, the subconscious has a perfect recollection of every single emotion that you have ever generated and what caused it and how long it's been there and where it's stuck in your body. And if you inherited a negative emotion, your subconscious knows from whom that emotion originated. And so you can very quickly gain the awareness piece through muscle testing. One other thing that the subconscious knows is what emotions are contributing to different medical problems. So if there was an emotional component to your migraines, or if there's an emotional component to your high blood pressure, or to cancer, or to back pain, the subconscious would know if there was an emotional component and what emotions were contributing to that problem. So to ask the subconscious a question, you do so through a muscle test, a very simple muscle test. And so I'll demonstrate the one that I use mostly. So I use my fingers. So right now I'm using my left finger to resist being pushed down, and it's able to maintain its strength. But now you can see I reduced my strength to this finger, and now my right finger is able to push down my left finger. So this would be a no response, and staying strong would be a yes response. So you can use this to ask a direct yes/no question. You can also use muscle testing to ascertain what you believe subconsciously. So if I were to say, I tend to use this finger and then my pinky finger to push down, okay? So this is yes, this is no. So if I were to say, my name is Dr. Barker, then my muscle strength is nice and strong. But if I say something that I don't believe, such as my name is Sally, then even as much as I try to resist here, I can't. I can overpower it very easily with my pinky finger. And so then if I were to say a yes/no question, I'll start with something, that is a simple yes/no question, like my age. So I'm 37 right now. So am I 37 years old? And I get a nice strong response. Now I'll ask a question that the answer is no. Am I 27 years old? And it's very much different, a different feel there. We can do another yes/no question that's pretty easy to figure out the answer to. So am I male? And I'm testing nice and strong. And am I female? Again, I don't have any strength to resist in that finger. And so I would encourage you to start practicing. You don't have to use your finger. You can also have your arm out and ask the question, my name is Dr. Barker versus my name is Sally, or any variation of yes/no. Some people will use their hip flexor muscle and lift their knee up and push their leg down. You can use any muscle. I find it's easiest to use my finger because it wears out less and I don't have to put a lot of force into it. And one trick to this is to you don't want to hyper focus in on the what muscle testing you're doing. You almost want the muscle testing to be in the periphery of your awareness. So you're only paying attention to it enough to know what the response was, yes or no. And you can ask the questions out loud, or you can ask the questions in your head. So once you start to get comfortable with a yes/no response, and you're consistently getting a yes response to a question that you know the answer is yes to, and you're consistently getting a no response to questions that you know the answer is no to, then you can start using it to ask questions regarding your emotional state or your belief state. So if you're working with, you're trying to release the emotions from a particular event, or you can confirm what emotion is maybe coming up, or if you're trying to figure out if there is an emotional event or emotional components related to one of your medical problems, you can ask, is there an emotional component to this problem, and start to work on the emotional component. For the belief statements from my video on how to stop generating negative emotions and working with the 5 questions, so if you come up with a true positive belief statement that you want to have and you don't think you have it yet, you can say the belief statement. So feedback, I welcome feedback and criticism regardless of its utility. See, right now I'm testing strong because I've already fixed that belief. But before I fixed the belief, I tested weak while saying that statement, which let me know that I didn't yet believe it, and then I programmed it in, and immediately the muscle test reverted back to normal. So this is a tool that doesn't cost any money. You can do it on your own, and if you are struggling to learn how to muscle test, there are courses for it, and you can also use muscle testing to help another individual. So I use muscle testing to help my patients, and so if you are struggling to incorporate muscle testing into your practice, you can always schedule an in-person or phone appointment with me to work on getting to the emotional root cause of some of your medical problems, and help to utilize this tool as best to its ability. So thank you so much. I hope this helps. Have a fantastic day.